Good evening, my name is Tiana Tabor. I'm in BSN 225. Tonight I will be doing or performing my skills video on ophthalmic medication administration. I have all my supplies set up, my rag, my cotton swabs, tissue, hand sanitizer, medication, gloves, trash, patient. All right, so I am first going to confirm the patient's medication order, which is Timomol 0.25%, 1 drop in each eye 2 times a day. I am going to use the 6 medication administration rules, which is right patient, right time, right dose, right drug, right route, and documentation. I am then going to look at the EHR, and I'm going to make sure that the medication matches what is in the EHR to what I have on hand, which is Timomol 0.25%, 1 drop in each eye 2 times a day. All of that is correct. I'm going to now enter the patient's room, introduce myself. Good evening, my name is Tiana. I'll be your nurse this evening. Close the curtain for privacy. I'm going to practice hand hygiene. Can I confirm your name and date of birth? All right, Mr. Alvarez, can I please look at your wristband? Look at the wristband, confirm the information is correct. I'm going to put on my gloves. Okay. All right, Mr. Alvarez, do you have any allergies? No, the patient does not have any allergies. So tonight I'm going to be administering the medication, ophthalmic medication drops that your provider has ordered for you. The medication is Timomol 0.25%, 1 drop in each eye 2 times a day. Do you have any questions? No, the patient does not have any questions. There are some side effects, which are dizziness and fatigue. The adverse side effects would be shortness of breath or slow breathing or slow heart rate. If any of those happen at any time, please let me know as soon as possible. And then when I administer the drops, you will feel some stinging or burning. Okay, so I'm going to get ready. I have my rag here. Should the patient have crusts or any discharge, I would wet my rag with warm water, tap water, and then I would place over the eye gently 1 to 2 minutes, and then I would take the rag and I would wipe from the inner canthus to the outer canthus and go to the other eye, place on the eye 1 to 2 minutes, and then I would wipe from the inner canthus to the outer canthus. And then I will discard in the trash, as well as my gloves, practice hand hygiene, and put a new pair of gloves on. Okay. All right, I am going to now administer the drops. I have my drops here. I have my tissue with my dominant hand. I am going to place the tissue just underneath the eyelid here, or just underneath the eye. I am going to place pressure with my thumb and my pointer finger, and I'm going to press down just underneath the conjunctival sac. Well, actually, I'm going to press down, and then which is going to then allow you to see the conjunctival sac. And I'm going to, the tissue is on the orbital bone. All right, so now I have my eye drops with my non-dominant hand. I'm going to open the eye drops, and then Mr. Alvarez, can you please look up? And I am going to hold the drops 1 to 2 centimeters over the eye. And I am going to place one drop into the conjunctival sac. Should there be any, if the patient blinks or closes their eyes, then that would mean that the drops would then they would not stay in the eye. So I would take my tissue and place it into the nasal sacral duct for 30 to 60 seconds. Mr. Alvarez, if you could please close your eyes gently just for a few seconds. And then I would, okay, sorry, that's there. And then I would take the tissue, go over to, or I would discard the tissue in the trash, go over to the other eye, and replace the drops, sorry, and do the procedure over. Now I'm going to go to the other side. I am going to place the tissue right on the bony area here underneath the eye. Actually, sorry. Okay. And then I have my pointer finger and my thumb. I'm going to gently press, or I'm going to gently press on the orbital bone, and I'm going to press down, which will then make the conjunctival sac, well, it will show the conjunctival sac. I have the eye drops 1 to 2 centimeters over the eye. I'm placing one drop into the eye. Again, should the drops leak out, I'm going to place the tissue in the non-sacral sac for 30 to 60 seconds, and then I will repeat the procedure. Okay, and then that concludes the drops. I am going to discard in the trash, remove my gloves. I am going to ask the patient if he's feeling okay. Are you feeling okay, Mr. Alvarez? He says yes. I am going to then place the patient back in a comfortable position. So I had raised the bed, put the bed rails down. I'm going to now raise the bed back down, place the rails up. Mr. Alvarez, I'm going to give you the call light within reach. So if you have any issues, you can press the button and somebody will come right in. How are you feeling? Are you comfortable? Yes, he's comfortable. So then I am going to, practice hand hygiene. And then I will document in the patient's chart the right patient, right time, right dose, and right medication, and any concerns or issues that came up during the administration. And I'm going to exit the patient's room, and that concludes my skills video.